Hi, Dr. Tim Silvester here. This video is for you arthritis sufferers that are out there. One of the most common questions that I get asked as a chiropractor is this. They say, Dr. Tim, is what you're doing going to help me with my arthritis? And the first thing I tell folks when they come in here and they ask that question is I say, well, you need to understand what arthritis is and where it comes from, because a lot of people think that you just inevitably get arthritis as you age, and that's actually not the case. What they found is that osteoarthritis is actually the #1 form of arthritis, and it is most often caused by a mechanical stress that's going through a joint. It's because there's a misalignment there that's putting too much stress on a joint, and it's causing that joint to break down prematurely. And I want to show you what that looks like on X-ray just so that you can get a little bit of a visual with that. When we look at any part of the spine, if I were to take a look at your neck, for example, because a lot of folks that come in, they have arthritis in the joints of their neck, but this applies to all areas of your spine. You should have a curve, a nice smooth C-shaped curve in your neck when you look at it from the side. And one of the reasons that's very important is because when you've got a curvature there, your neck acts like a spring. And what they found is that the spaces between the bones, they're called discs, they only take about 30% of the load of the weight of your head. The other 70% actually goes through the bony joints in the back. And they found that that's a very healthy ratio. When you've got 30% of the stress in the front and 70 in the back, your spine won't even start to degenerate until you get well into your 70s or 80s, which is great. No arthritis, which is fantastic. However, many of the folks that I see coming into the office, instead of having that curve, they've got a misalignment. I see a lot of folks that are losing the curve where the neck is very straight. Now, the problem with this is that your center of gravity shifts forward, and these spaces, those discs between the bones, instead of taking 30% of the load, now they're taking 70, 80, 90% of the load, depending on how far forward your head shifts. So if we don't take this misalignment and put that curve back and correct that posture, what you notice, this is what's called a phase 1 because it's out of alignment, but there's no damage yet. But if we don't correct phase 1, what we notice is that we degenerate into stage 2 of arthritis, which means that the discs, the spaces are starting to wear out between those bones. And what you will notice is that the discs that wear out are the ones that are under the most stress, the ones where there's the biggest misalignment there. So what you notice right here, we've got some good discs at the top, we've got some degenerating discs in the lower part of the neck, which just means this is the area where the stress is going through. The priority should be at putting the curve back, at getting the posture corrected so that we can balance the forces that are going through the spine again. But if we don't do that, this person here may be getting neck pain and headaches and back pain, and they may be taking Tylenol and Advil and painkillers and anti-inflammatories, and those things are not going to do anything to actually correct that misalignment. So what happens is the spine continues to break down, it continues to degenerate. This is what's called a phase or a stage 3 of osteoarthritis, and what you notice is that down at the bottom here, the discs are pretty much worn through. It's almost bone on bone. There's even bone spurs that are forming here. And the only reason that bone spurs show up is because there's a part of your spine or your skeletal system where there's too much stress. It's just another sign that your body's under too much stress in a certain area. So here, this is where the fulcrum of the stress is. This is where all of the arthritis, all of the degeneration is settling in. It's not related to this person's birth certificate, how old they are. It's related to this misalignment that they had. They went through these different stages of damage and never took the time to correct this. So what I want you to know about arthritis is this. This is the take home, is that your spine, if you keep things lined up, your spine is going to be healthy well into your senior years. If it's misaligned, that's what's going to cause osteoarthritis in your spine to break down prematurely. It needs to be a priority to get that corrected. If you personally have arthritis, if you want more information, please visit our website, gracechiropractic.ca. If you've got any questions, please comment below and share this video with anyone, because there's so many people out there that are suffering with osteoarthritis. We want to make sure that you tag those people, share the video with them so that they can get this information, because so many of the folks that I see are going through this preventable degeneration that we could help them with if they get this information in time. Thanks so much for listening. Again, I'm Dr. Tim Silvester. Have an awesome day.